Welcome, everyone. We are really excited to be here. Today, we're talking about coordinated intake, getting the inside scoop. And we have the standard LSC slide, but hopefully this works. We also have the fun slide that PowerPoint suggested to me. Today we have a fabulous panel. I'm going to have you all introduce yourselves, and then I'll introduce myself last. So Sarah, could you start?
Sure. Hi, everybody. My name's Sarah Coffey Bowes. I'm executive director at a tiny but mighty legal services organization in Maryland called Civil Justice. I have a personal and professional passion about coordinated intake, as dorky as that sounds. So I'm really excited to be here.
And I'm Kira Jarrett. I'm the CEO of the DC Bar Foundation. I've been there for 9 years. I am a lawyer by training, and we've been working on coordinated intake for a couple of years.
Hi, good morning, everyone. My name is Lara Atsuka. I am the Director of Business Administration at Southern Minnesota Regional Legal Services, affectionately known as SMERLS, and that's how I will refer to it for the rest of the presentation. I'm feeling no pressure at all following Everett Harper doing this presentation, so I'm hoping we can just do a fraction as well as he did. I came in October 2021 to SMERLS, which was kind of the tail end of the prep for coordinated intake and right before it went live. So I can speak to that and our experience after SMERLS went live. But that's a good segue to introduce Jay, as Jay has been also in Minnesota since the beginning of the project. So.
Thanks, Laura. So I'm Jay Singleton, and I work at Legal Services State Support in Minnesota, and we're a statewide coordinating body. We do a lot of work on tech projects, a lot of coordinating work, such as coordinated intake. And I will be serving as a moderator, and then again, backfilling a little bit for Laura for things that happened before she came in. So as we get started, we wanted to first ground this really in the client applicant experience. So we want you all to think about as if this were your life. So you live in Maryland, you're a single parent, you have 3 kids. You've been asking your landlord to fix several things in your apartment, and your landlord hasn't been responding and has now served you with an eviction notice, even though you've been paying your rent. So, classic retaliatory eviction. You have 4 days until your court hearing, and you can't afford a lawyer. So how would you figure out who to call for help? And I want you to just pause and think about that for your own jurisdiction. What would be the steps? What resources are available? How do you find them?
So in Maryland, we have more than 40 legal services providers. And so you as a tenant with your work obligations, your child care obligations, and 4 days before your eviction hearing, these are your options of where to seek legal assistance. They each have their own intake system, their own case acceptance criteria, their own applications, their own intake hours, and you as a tenant have to fit yourself in and find the right fit. So in my work in a previous life, I was at the Maryland Courts Help Centers. We're a network of judiciary-sponsored help centers. We are empowered to give legal advice. And so I would, as an attorney, trying to match people with legal help, send people with a sticky note out into this stratosphere. They frequently returned confused, frustrated. As my time at the help centers went on, I was increasingly tasked with finding intervening mental health services for our clients who were hopeless, who were frustrated, who were facing loss of their family or their home, and were unable to access legal services. So in this ecosystem, and as Jay said, try and frame it in your own ecosystem. About 80% of people, and this is consistent, 80% of people who enter this ecosystem are getting brief advice. Only 6 to 9% are actually getting litigation representation. So we are briefly advising the heck out of people. Also, we have about 100,000 people who are moving through this kind of newly developed court help centers, getting legal advice there. So 100,000 people getting legal advice through the court help centers, and then 80% of the people who enter this ecosystem are also getting brief advice. So, 8 times out of 10, you're having somebody come back who is going to court alone, who have received some brief advice and are ultimately going to navigate loss of their home alone.
And move on to describing so that we're all, again, grounded on the same page about what do we mean when we say coordinated intake. So I think, Laura?
I can take that. So yes, within that context, and we'll get into more detailed explanation as we go through this presentation, but at its most basic level, a coordinated intake is about getting the clients to the right organization the first time and reducing what we call bounce. You might have heard that term within your own ecosystems where a client is getting bounced around from legal aid org to legal aid org. None of them are quite the right fit. So we're trying to eliminate the bounce, get them to the right place on the first try. And the goals also along with this are increasing access to legal help overall, having more equitable outcomes, reducing client frustration, having greater transparency and improved information sharing is really key between legal aid organizations and community organizations as well. And then some of the values at play are informational accuracy, again, building that equitable legal landscape, having more efficient services, and easier access to efficient legal services.
Great, thank you, Laura. So we've talked about, just in a general sense, like why coordinated intake. And I think for a lot of folks, it does make intuitive sense. But I'm wondering if each of you all could talk about within your own jurisdictions, how you established that need and what was the tipping point for your jurisdiction to say, yes, we need to do something about this complicated landscape to make it easier for clients to navigate. So Kira, could you begin?
Sure. So what I thought was so interesting about the slide about Maryland is that DC is very much the same. We have probably worse, I guess, because we have more than 60 legal services providers in a 70 square mile area. And so I know I see your mouths dropping. And so that has been a problem for some time. The foundation has existed since 1977, and there are a couple of the legal services providers that predate us, but it has become more complex in more recent years as more niche organizations have been established. So some that focus, for example, on women of color who are survivors of domestic violence and sexual assault east of the river. That's like a really niche one that was created because those needs weren't east of the rivers, east of the Anacostia River. So it embraces the poorest, most marginalized people within the district. And so that's what I mean when we say east of the river. And that's a need that was not being met by some of the existing organizations. So that's sort of the context. And then probably for about 20 or 30 years, there's been this conversation within our community about the number of legal services providers and how difficult it is to find help. And we, as the foundation, so the DC Bar Foundation is a funder, so we get our money primarily through the District of Columbia government. We also are the district's IOLTA administrator, and then we have a private fundraising effort. But the private fundraising is less than $1 million, just to give you context, and the money from the district government at this point is over $30 million, so it's a big difference. But there had been a number of conversations over the years about how do we tackle this. And so as a funder, we initially tried to do it through our grant program. So we experimented with giving a grant to a legal aid organization specifically to come up with a way that we could approach this. And then the last time we did that was probably, I think it was 2019, so right before COVID. And then during COVID, I think COVID made people sort of sit back and say, wait a minute, we really have a problem here and we really need to do this differently. And now's the time to think about it. So I think a combination of trying something one way, recognizing that COVID created the situation where we absolutely had to do something different, and then the foundation realizing that trying to do this through a grant to one organization was not going to work. So we contracted with A2J Tech, and Joseph is here in the audience, and we asked him to come up with a concept about how we might approach this. So Joseph looked at, and like probably many jurisdictions, we had a number of needs reports that already existed. Our consortium of legal services providers had done a community needs report in 2016. Our Access to Justice Commission had done a report in 2019. And there were just, there were already a number of resources out there that said we have a problem. So we asked Joseph to look at all the studies that had been done, to interview legal aid organizations, executive directors, individuals, people who'd been within our community for some time, to say, what do you think and how might we go about this? And that led to a concept paper. And there was nothing like putting something in writing to get people to react to, and that sort of kicked things off. And at the same time that that was happening, the DC Bar Foundation had adopted a strategic framework in 2019 where we said we want to change the delivery of legal aid within the district. We need to do something differently, and we need to engage with all stakeholders to do that. So we can't operate within our legal aid silo. So we worked very well with the DC Access to Justice Commission, with our legal aid providers, but we didn't do so much with social services providers. We definitely weren't partnering with technology or the arts or you fill in the blank. And so we, as a part of the strategic framework, also began what we're calling the Legal Aid Transformations Network, where we wanted to bring people to the table who are serving the same community to say, how can we work together to make it easier for the client to get the services they need, whether they're legal aid or some other service. And so that was sort of the framework that was a tipping point, I would say, between the strategic framework and COVID. That was the tipping point to really push us forward to do this network, and for the Bar Foundation to step up and take a leading effort.
Thank you, Kara. And Sarah, could you talk about the process in Maryland?
Sure. So this is not Maryland's first attempt at coordinating or centralizing intake, as we used to call it. It was probably about 20 years ago that legal services providers, there was funding put in. They came together over the course of about a year to try and kind of all get on the same page. And it's just kind of talked about in hushed tones in hallways now. But you have a lot of the same leadership that had put a lot of time and investment into that process to watch it not come to fruition. So with a lot of that same leadership, there's some hesitancy to go back into what was a really sounds like a unhappy experience. So really what happened was there have been leaders in our community that have been saying, is there a better way? Is this the best way? Is all of us having our own intake staff and our own, having people call all these numbers the best way? So I think the conversation has been, at least going on again for maybe the past 10 years. Just select leaders in the community really starting to question, can we do better? But I think the tipping point came with COVID. And in Maryland, our Attorney General partnered with the Access to Justice Commission in Maryland and launched a COVID response task force. What grew out of that, and then as part of that, advocates had also been on the ground trying to enact a right to counsel. It's called Access to Counsel in Maryland because we're managing expectations, but introduced this Access to Counsel program. As part of that, like any good state, we like our task forces, so we formed this task force, the Access to Counsel and Evictions Task Force, and they really dug deep, and I think we included it as an attachment on what an effective rollout of access to counsel and evictions would look like. And lo and behold, coordinated intake was on the list. So again, to your point, putting it in writing, I think a lot of us were in our offices reading it going, yay! So we're starting with this kind of discrete case type. It's housing. It's a huge issue, but it's housing. And so our IOLTA funded program was tasked with, okay, you guys are going to administer this program. You're going to administer the funding. And they issued an RFP for a coordinated intake system. My organization, CJ, was of course very interested in it, but really didn't have the person power to staff a statewide call center. We partnered with Joseph, again, from A to J Tech, who had been working in Minnesota and in DC, and we had been working with him on other programs. And we responded to the RFP. We were awarded the contract, so that's where we are now. But yeah, I would say COVID, long-term discussions of people raising questions, COVID, and the resulting access to justice, access to counsel and evictions task force saying coordinated intake needs to be a part of this process if we're going to effectively match tenants with representation.
Thanks, Sarah. And Laura, could you tell us about the toll report?
Sure thing. Coordinated intake came about a little differently in Minnesota back in 2017, so pre-COVID days. Our Supreme Court Chief Justice asked LSAC, which is the Legal Services Advisory Committee and our biggest funder, we love our acronyms in legal aid, asked LSAC to investigate improvements to the statewide system and the creation of an intake system where there would be no wrong door. That's a quote from the report for clients that are seeking legal assistance. And I believe we also added as an attachment what's been deemed the Toll report. That's because it was written by a man named John Toll. That outlines the results of that investigation. And I won't get into all of that. It's 27 pages long. But a couple of the main findings of that report is that there was a lot of bounce, which I talked about earlier, with potential clients being bounced around between different legal aids. There were actually two different kinds, well, really three, but I'll only touch on two different kinds of bounce. There was the external bounce, where if a client was first at a social services organization or going to their church for help or another community organization, they weren't sure exactly where to send them, so they might send them to the wrong place, and then they'd get bounced until they made it, hopefully, to the right place. But then even internal bounce within the legal aid organization. So even if they went right to a legal aid org, they still might get bounced around. And a lot of that was happening with just being handed phone numbers or told phone numbers. So now you got to call this org. So you can imagine that kind of frustration on the clients. Now call this one, now call this one. So how do we eliminate that? And so really the idea, again, is to take the burden of all of that off of the client and put that onto us to figure out where they should be with that first phone call.
Thank you, Laura. So now we know kind of like how these projects came about, and I'm wondering if each of you could kind of talk about the key elements of each of your projects. And I know that in each of these jurisdictions, like you're planning to, or you have implemented things a little bit differently. So could you talk through some of those different flavors of coordinated intake? And we'll just go in the order of the slide. So Maryland, DC, Minnesota.
Okay. So Maryland, we are just starting. We got the RFP, or we got the contract in July, and so we have just really started this process. Not only are we partnering with A to J Tech, but we are also partnering with United Way of Central Maryland. Like many United Ways, they operate a 211 system. They already have the call center capacity. They are staffed by masters of social work, community resource specialists who are already well trained in helping people who are going through stressful or traumatic experiences. And they were really interested in lending their expertise in managing high volume call centers and serving the public. So it came together with civil justice's passion and commitment to using technology to improve how Marylanders find legal help, our already existing partnership with A to J Tech, and then United Way of Central Maryland really stepping out and saying, we would like to collaborate with you on that. We are just starting in housing-related, so eviction cases, which I think gives us an opportunity to really think through some of the processes and challenges that Everett identified this morning in his wonderful talk. We are beginning in Baltimore City because we had a federal source of funding related to COVID assistance funds. So we're using a federal stream coupled with a state stream to fund the project and to fund the representation as well as the coordinated intake piece. it is mandated, and this is like kind of key. So if you are an organization who wants to participate in the Access to Counsel in Evictions initiative, and you are awarded a grant, it is required that you participate in the coordinated intake system. So one thing that has kind of been emerging is civil justice has not traditionally been funded by our IOLTA program, but we have a new collaboration with them. And our Maryland Legal Services Corporation has really stepped up as a thought partner in the process because this is a real sea change in Maryland. It is a new way of doing business. And as Everett said this morning, lack of certainty causes fear. So we're really working through with them how to best communicate with legal services organizations and really how to reduce uncertainty and increase the possibility of success. Last thing I'll point out is that the intake will be conducted by the 211 staff. So we are not using attorneys to conduct the intake. We're using, again, those masters of social work level staff at United Way.
And because I'll skip to the technology. So in the district, and there's one thing I wanted to point out for us, one thing that's been really important is making sure that people understand the difference between coordinated and centralized. And so our goal is not to centralize intake. Our goal is to sit on top of the existing intakes that exist. And those are a combination of individual legal services providers, and then also we have a number of networks that exist. So we have a network that's focused on landlord tenant. We have one that's focused on family law issues. We have one focused on consumer debt. We have another that's focused on victim recovery. So we want to make sure that we're sitting on top of that and not replacing those. And that's a part of the fear, which I think we'll talk about a little bit more later. But the idea is that whether it's through a web page or a phone number, someone will be able to call and get to the right place on the first try. And then we also want to embed that technology on the websites of the existing intakes that work. So as we've gone through, we're gaining some momentum. And so we've gotten funding from, for example, the American Bar Endowment, and we've gotten funding locally from the Wells Fargo Foundation. This, in FY22, we got $1 million in restricted funding from the district to support the effort. And that was probably the first big signal that we had buy-in on this project. And trying to think, we only have one LSC grantee in the district, and it's the Neighborhood Legal Services Program. And the NLSP, another acronym, NLSP is who applied for the TIG grant. And so we are a part of that effort. And I'm pausing for a minute because we meet weekly on this, and it's the first time I've seen Monique in person as we work on coordinated intake and referral. But so those are a number of the funding sources that we've cobbled together to support this effort. It's not mandated. Legal aid's level of participation, I put TBD because we're not sure. So as I said, we have over 60 legal services providers in the district. The foundation funds anywhere between 31 and 33 in any given year. So we have to figure out if we truly want someone to be able to get help from whomever they need to get it to, whoever's the best organization, how do we incentivize people to participate in the system? And so we could condition grant funding on participation within coordinated intake, but that still leaves out, let's say, 30 organizations. And so then the question becomes, do we incentivize people through money, whether they're an existing grantee or not? And then how much money is that? So trying to figure that out from almost a pricing perspective, how would you determine this? So it's TBD for us. Our hope is that over time, people will see the benefits of participation and we'll have a greater percentage of providers participating than not. And then in terms of how involved is the funder, we're leading the effort. I mentioned earlier the network development effort that we're doing. As a part of that, we interviewed various stakeholders and we specifically asked who should lead this effort, like who's best positioned to do this? What do you think? And pretty much universally, people felt that the Bar Foundation should use our sort of convening power to bring people to the table and have these conversations. So we did it reluctantly because I know we'll talk about this later too. It's a difficult effort. It's a big lift. I see Bridget nodding her head from Minnesota. It's a huge undertaking. It's well worth the effort, I believe, but it is a big undertaking. But we are leading the effort. And then in terms of how it will be staffed, we expect that we'll have navigators who are answering the phone or on the back end of the website. Right now, that will be housed with the Bar Foundation, but over time, it's my hope that one of the legal services providers will take over that function.
I'll round things off with Minnesota. We are almost done. It's been a long road since the toll report was first issued in 2017 to where we are now. We did have COVID in there in the middle, so I just want to throw that out there too, which obviously kind of derailed a lot of things. But we had the first two, so just to back up a little, the way that coordinated intake works in Minnesota, you might have seen, if you've looked at the toll report, you'll see that what they originally had recommended was one central call center that was going to be sending out all of the calls. Well, part of the thing we learned along the way is that really wouldn't work as well as because things were so different in the various regions. And so what we ended up with is having 4 regional hubs and call centers in each of those regional hubs. So we have the 2 northern regions, LASNM and LISNM, to throw a couple more acronyms at you, but that's essentially Northeast Legal Aid, Northwest Legal Aid, and then SMERLS, we have the southern region, and then MMLA, which has the central region. Those first 2 in the north went live in 2021, and there's less populated areas, so I think that was by design. You can correct me if I'm wrong about that, Jay, to start out with the less populated areas. And then SMERLS went live just this past June of 2022. And MMLA, I think, is slated for this spring, so then we'll finally be there. So almost there. The motivation for the project we already talked about with the toll report. Touching on the technology, one of the keys has been using the same case management system. So we chose Legal Server for this project. So all of the organizations that are involved in coordinated intake got Legal Server. And this is key because we e-transfer cases between organizations. So if someone calls our intake line, we can take that initial information and then we can e-transfer it right to the organization where it's going to go. It'll populate. So they'll already have that information populated in their legal server, and then they can just go from there to streamline that process. Twilio, Jay could talk a little more about if you were interested, but that's really the call center, the technology that takes that phone call. So when someone calls that 1-800 number, they put in their zip code, and that figures out which of the 4 hubs it's going to send them to. And we do have bilingual staff on our intake staff. We have 4 different languages other than English, and then we can also use translation services as well. The project funding I mentioned earlier came from LSAC, who had put in some one-time investments. Really key is having state support. So Jay's organization that's been coordinating the project. We're also working with A to J Tech, so you can hear Joseph's name a lot. And also a couple of key things they've done recently is provided the funding for an LMS learning management system training, and that's been really helpful. We can load in trainings for intake staff that can be used across all organizations. State support is kind of manning that, but we each have our own branch. And also a callback system. One of the things I didn't mention earlier is another finding of that toll report is the difficulty in reaching a client if you're trying to call them back. And I'm sure all of you have probably experienced that and how hard it is to get a hold of them. This is a new scheduling system where if someone does an online intake, this will pop up at the end and it lets them pick a time when we can call them to get that information. And this started, I think, in Missouri. Is that the first place that used it? And I think, Joseph, you can tell me if I'm wrong, but it had an extremely high success rate of almost 80%. Is that about right? Okay. And LSAC has funded that for all of our coordinated intake organizations as well. It was mandated from the Supreme Court. It doesn't get much more mandated than that. And all of our civil and legal aid the big organizations are all involved. Those specialty organizations are not all involved. I know some of them, I believe, Bridget, are interested in kind of coming on board. And there's talks about that. But again, there's that case management system that they would need to do that. Our funder has been very involved. I'm sure Bridget's laughing back there. She's been very involved in the process. We've had lots of meetings. We have director level meetings. We have intake staff level meetings, lots of communication. I'll talk more about that later. And as far as staffing, we do use our we had an intake staff already. Smurls was a little different from the other organizations in that we already had a hotline attorney program. So in our program, intake takes the call, but then they send that call to a hotline attorney who makes the determination of whether that's going to be a full service or can give them advice right then. So we have that hotline staff already in place as well.
Yeah, and just to repeat the question for the recording, what do you do if there are like very like legitimate grounded reasons to not trust one of the organizations that you need to work with? For example, they're going after your funding. How do you address those real life situations?
Like many states, we're not without our kind of mistrust amongst or legal services organizations. I think a couple of things that we're working through that have really come into play are a strong leadership presence. So our IOLTA funded program really taking some lead and setting some standards as far as how this will work and what input is needed. I think that one thing I mentioned earlier is that really make the power of smaller organizations kind of coming together and saying, or whatever organizations in your ecosystem. And this is one of the things that we really wanted to bring out of this conversation is like, how does this work in your world? Because they're all different. But organizations joining together to kind of develop a collective vision and a collective need, so that strength in numbers. And really, I think for us evaluating kind of one thing that we're going to talk about later, it's who are the necessary parties. And if that organization that is not really trusted is a necessary party, then how can the collective work together versus kind of separating people out into silos and each addressing that mistrust individually?
I might add just one thing to that. We have been spending a lot of time on relationship development. And so in the network, the Legal Aid Transformations Network that I mentioned, we're working with the Interaction Institute for Social Change, IISC. Those are our facilitators. And we do these quarterly convenings, and we always start with this touchy-feely business that people are really frustrated by. And people are like, well, could we just get to the meat of it? Could we just like get to what we need to talk about? And they've been very insistent about the importance of, no, we have to have these one-on-one or these 4 people in a breakout room because you have to get to know one another. And so I always joke that it's like when you're in a car and you're like, where are we? What exit are we at? When are we going to get there? Who's got the map? And so it's like all that conversation that's happening in the car before you get to the destination at the end of the day will put us in a better position. But it is incredibly difficult because there are issues of big fish, little fish, racism, racialized words, the funder being the player. Well, if I come to the table, does that mean I'm going to get more money? Is my funding contingent on this? Is this going to influence your decision making? So I think the relationship management piece is really big, and then having direct conversations and not the side conversations. So at the end of the day, we have to be forthright, and we have to put those issues on the table. And we've seen that with the smaller networked efforts that we've had, where you've got, let's say, 6 legal aid organizations. And sometimes you have to have an outside facilitator come in to bring those issues to the top. But for some of our efforts, we're 5 years in, and it's night and day from where the organizations were at the beginning.
And I would just add, I think we were fortunate in Minnesota that we already had good relationships between the organizations. And this is where I'm at a bit of a disadvantage because I came in late, but that's how it seemed to me coming in from the outside. I think there was a little bit of the fear maybe with the smaller organizations, are we going to get enough cases if all of the calls are coming through all of you? But I think we've been able to manage that through good communication, to your point, Kira.
And I'll add, I think in Minnesota, bringing in an independent, in this case, Joseph's team, an independent third party who didn't have a stake in the game in the same way, helped us, I think, get past. I think we had kind of stalled a little bit. Bridget's nodding, so I think that's fair to say. And I think bringing in that outside person kind of helped us get to the next phase, because we had someone who was just like, "We're gonna do this, let's do it," and we could all just like look to them for leadership, and to get past some of those disagreements.
I would just add on that civil justice is not participating in the access to counsel and eviction. So building on your point, Jay, like, we're neutral. We're not going to cherry pick cases. United Way is not going to cherry pick cases so that you have the best results because you got the easiest cases. So I think, yeah, having neutrality of the people that are, or the organizations that are developing and operating the coordinated intake system, there's really something to be said for that. I think I saw.
They will increase volume tremendously. So how do y'all avoid kicking the can down the road when it spits out, there's a services agency and then there's just not, we're full. Or when the referrals start, some other agency, we're full. How do y'all handle that?
Yeah, and so the question is coordinated intake. I think a lot of people agree will increase volume. So how do you handle not just saying no to more people down the line? And that's something we've talked a lot about in Minnesota.
Yes, I was going to say we're jumping ahead a little bit because that's one of the things we talk about a little later in the presentation is about staffing. But I will say that that's one thing I can say is that our volume has increased. It's a little hard to say, though, because we had eviction moratoriums that were ending in the state right at the same time SMERLs went live. You have inflation, you have all these other factors. So how much of that, it was hard to say how much of that was just contributable to coordinated intake, but we have had an increase regardless. And I don't know that there's an answer per se, but we have increased our staffing. We did add a position for an intake worker. We're now looking at adding another hotline attorney, but I think it's going to need to be kind of a gradual increase because you can't just, as you don't have the budget to suddenly hire 10 more people. It's not going to work that way. But that is one thing. That's one of the lessons learned is that we're going to have to look at how we're handling those calls. But that's how we've done it so far.
Yeah, and I think when I zoom out and think about that question, the other thing I think about is that we have the potential to see all those cases that are coming in and then make more strategic decisions or more decisions grounded in our purpose and like the core things that our organizations want to address. I think that if we're just like missing so many people, and I mean, I've heard lots of people talk about like how many people don't even ever make it to legal aid. So if at least we can get some more of those people in, and then it's like really hard, challenging work to then look at that like from a data level, from like a values level, like figure out, okay, we're getting all these people. We can't help all of them, but at least we know like what a better sense of what the need is and can make more strategic decisions instead of just always being flooded and just doing what we can. So,
No, that's a great point.
Yeah, another question.
So, quick question. In the beginning, you mentioned about 80% of most of the services are advice. Do you expect a coordinated intake system like this maybe to produce maybe a higher number of extended services or recommendations?
Yeah, and the question is around whether our coordinated intake systems, we expect to increase advice or increase extended services. I can talk a little bit in Minnesota, I think, and Sarah, I think you have a different, Maryland has a different perspective maybe, but in Minnesota, part of our toll report was to increase the availability of advice so that if you call in, you will get advice, assuming that you meet eligibility criteria. So that's been a big part that we aren't really talking about much today, is that we're calling it high volume advice, but kind of hotline style advice in Minnesota. So we expect advice to increase, and then hopefully be able to make decisions about extended rep for those based on those calls that come in. But I know, Sarah, you have.
Oh, I have thoughts. So again, like this great opportunity to evaluate your own ecosystem is that Maryland is saturated with brief advice. And that has kind of changed rapidly over the past 10 years with this emergence of the court help centers, which unlike many states are empowered to give legal advice. So you've got a huge volume of people, more than 100,000 people a year moving through that system. And so one of my theories, and I would love to have, the resources to like actually back this up, is that if you can drive down the demand for brief advice, if you can coordinate intake so your frontline staff are not fielding so many, I'll call them inappropriate calls, can you take that increased capacity and start changing that number? When Ron mentioned 90% of people in the Justice Gap report don't get effective assistance. To me, coordinated intake can really start to change that if we're really intentional about what result we want. And if the result we want is increased justice, and I think increased justice comes with more of us getting into court with people, whether it's just settling their case or whether it's actual like representation at trial, can we start to change that narrative? Can we start to really expand what justice looks like? Again, that's very unique to us because there is no more room for brief advice in Maryland. It's just we have an embarrassment of riches in that sense.
I know that a difference was said about coordinated and centralized intake. I honestly don't know the clear difference yet. And I also, I'm from California, we're legal assistants, and we have like 18 offices throughout California, and we use Legal Server as our case management system, and we have like 50 plus funders. And one of, I guess, my problems, and I guess Grant's problems, is that we want a better intake system that's easy to use for the field offices, but also captures everything we need for all the different vendors. So, what do I do? Is this the right?
Not it.
So I'll repeat the question for the recording. So 2 questions. One, talking a little bit more about centralized versus coordinated. I think I'll throw to you, Kara, if that's okay. And then the second one, so you're using Legal Server. You have a lot of different funders. They have a lot of requirements. How do you make that work for an effective and easy to use intake for your field officers? Yeah. So let's take the first one first.
So in DC, for us, there will be a difference between coordinated and centralized. So this is not going to replace what exists. So we're not going to put in one place all intake workers, and that's where all the calls are going to happen. So the existing numbers aren't going to disappear. The existing websites aren't going to disappear. We just want more coordination among us. So I hope that answers your question in terms of the difference between the two. But that's a big part of the fear. And so I feel like we've explained this a lot in a number of different ways, whether it's on social media or our website or the newsletter or webinars, but we're just constantly reassuring people that we are not going to replace your existing staff. We're not going to take that over. It'd be impossible.
Yeah, in what we're doing that might be of help is we have Stout evaluating the Access to Counsel and Evictions program, including coordinated intake. Stout has very specific things that they want to track, and we have a limited data set of what the coordinated intake system through United Way is going to collect. We don't anticipate that coordinated intake system will collect information for your 50 different grants. God help you. But what we anticipate happening is once for example, California Rural Legal Services picks up the case, you will still have to do additional data collection. We're just trying to warm it up, package it, and get you the best referral possible.
You know, I'm wondering though, I'm not sure where you're from, but I'm wondering if you have a regional association of grant makers, and if that is something that you could bring to a group like that. In DC, we have the RAG, it's called, Washington Regional Association of Grant Makers, and I sit on that board, and that just feels like a perfect something to bring to a group like that to wrestle with and figure out.
Yeah, it does. It feels like a funder thing.
Yeah.
I think, like, thinking about it from, like, if this is how it is and you can't get any movement there. I mean, I think in Legal Server, trying to use guided navigation perhaps to, like, figure out, okay, this grant only covers a subset of cases, so only ask those questions. But that, I mean, that's a huge lift. In Minnesota, we're trying to come up with a dreaded standard pre-screen where we get everybody to agree to ask, like, the same 8 questions and use the same values for each of those fields. And it's really hard, especially because you have that, like, that data collection piece layered on top of things that people feel like they really need to collect for funders. And it takes everybody in the system, if you're coming to a coordinated intake system, to then kind of rethink their processes, kind of in that way of, like, not just within your own silo, but like how that impacts being able to effectively transfer cases amongst various organizations. So I don't know, it's really hard, is the not very helpful answer.
I would just add, it does help to have, I call them legal server gurus. So we have people within the system that really know legal server. I'm thinking of Amanda from your organization and Caitlin from Just Tech, and they've just really been key. We'll bring them a problem and say, hey, we need to do this for coordinated intake. How do we make this happen in legal server? And they figure out the engineering part of it and come back to us with the best answer that they can find. And that's been really helpful and effective.
Very quickly, could each of you tell me what elements you think really have to be in place for coordinated intake to work, and how do you get the necessary buy-in?
I can go ahead and start because my answer has pretty much already been covered. So we talked about that neutral party, again, with A to J, and to some extent state support as well. That's just been really key as far as saying that you avoid that argument of our way is better. No, our way is better. And you have someone saying, this is the way that makes the most sense for the client. And I just can't emphasize enough how helpful that has been in moving things forward. As far as buy-in, you have to get buy-in from the organizations, but you also have to get buy-in from your own staff. So I can touch on that a little bit, and making your staff a part of the process as early as possible. I think that was a lesson learned. Talk to your intake staffers. They are the people on the ground. Make sure that they're involved. That's why we ended up having those 2 different meetings with the director level and then the intake level, because you really need to hear from your people that are taking the calls. This isn't going to work because XYZ. And I think, Everett touched on that in his presentation this morning of having the right people in the room.
What comes to mind for me is hope and a belief that it can be better than it is. And so in some of these difficult conversations, it's sort of what we fall back on is, and are we here for the client? Is it about what's easiest for us or our fears? Or is it about how we change the system? And so it sounds kind of hokey, but I think that's a critical element, a critical belief that otherwise it's not going to work. And I think that's the difference, at least in DC, between, let's say, 20 years ago and today, where people are coming to the table and wrestling with these issues and having the hard conversations.
I don't really want to follow that answer, but that's a good one. I think for us, strong leadership, a funder saying, this is if you want, you don't have to take this money, but if you want to accept funding through the Access to Counsel and Evictions program, we are going to need you to do coordinated intake. And one lesson I learned pretty early was that mandate doesn't equal buy-in, right? Seems like, oh, right. And so we have spent a lot of time mostly via Zoom, doing meetings, answering questions, meeting with individual legal services organizations, meeting with leadership, meeting with frontline staff. We've really been working the chain up and down and listening, which has elicited some big revelations for us as to what the legal services organizations would really need. So listening and really working all elements of the leadership chain from frontline staff up to executive directors.
Okay, moving on to costs. That I saw that was a big one when we asked you all about biggest barriers. So starting with you, Laura, because Minnesota is pretty much there. What are some of the cost considerations?
Oh, this is another thing we've already touched on. That's where I was going to talk about the staffing. Having the staff in place, I would say, is probably the biggest cost. There are the initial investments in technology, but I think you're going to talk a bit more about that, Jay. So I'll let Jay handle that. But as far as the staffing, we did decide we needed another intake person. We added that position. That's been really helpful. But then more calls were going to the hotline attorneys. That's a more expensive position to staff, so that's taking a little more creativity. We've pulled a couple of other attorneys in to kind of be backups on the hotline when they're really busy, so that's one way. But we're also looking at funding another hotline attorney position. So I would say staff is the biggest cost we've run into so far.
Yeah, I think, yeah, so from a direct service program, I think that makes sense. From where my program sits, where we're kind of the coordinating body, where like a lot of the infrastructure costs are things that I think about. So everybody's on legal server. And a lot of these costs, I'll say, like impact not just coordinated intake, but are things that benefit the whole ecosystem and the whole legal aid organization. So legal server, my organization runs a database that's connected to our statewide website, Law Help MN. Loon, the legal organization's online network, where that serves as kind of like a legal server referral hub almost, where you have up-to-date referral information. We have kind of that tech layer to route people to the right hub. In Minnesota, we have a reporting system that we're developing where we are creating dashboards to see so that we can quickly see like the health of the system and any issues that are coming up. And then we have a learning management system that Laura had talked about earlier, where we're using that to push out trainings, or will use that to push out trainings related to coordinated intake. So I think like as you add more layers, it does get a little bit more extensive, but all of these things we're using for pretty much for beyond just coordinated intake. So I think they all help like beyond just the nitty gritty of getting callers to the right place. It also helps for a more effective system overall. And then in terms of like people, we had project managers who helped us shepherd us through the implementation phase. And then my office has one full-time employee who works solely on coordinated intake in Minnesota. And she's the one who's like getting the emails like this e-transfer should have been accepted, but wasn't accepted, and like handles kind of those day-to-day issues that come up.
So we're in the building phase. I would say our top 3 cost considerations are staffing. I mentioned earlier we have a weekly 90-minute meeting that nobody, I'm sure, budgeted for or planned for when we first started doing this. Again, I'm looking at Monique, who always shows up with a smile. It's a great meeting. We have lots of laughs, but it is a time commitment. And then technology, having someone to build the platform and to work on that. And then I would add evaluation. So we wanted to make sure that from the beginning, we were, number one, making sure that we had the user perspective. So we've been working with MPC, who's our evaluator on our Right to Counsel-ish program. We've been working with them for 5 years, so we're partnering with MPC on the evaluation component of this. So making sure that as we're building it, we're getting the user perspective through focus groups and other means. And then also once it's built, that we're tracking the right data and we're making sure that it's working for people. And then the one at the bottom, the marketing/communications one, that was an unexpected expense. So we do have communication staff at the foundation, But we actually hired someone, an outside person, to help because the number of stakeholders involved in this sort of effort and the communications effort associated with it, I completely underestimated. And so that's been an additional expense that I didn't anticipate that we would be able to handle internally. We just couldn't do it.
The only thing I'll add is that after a couple of really wide-eyed, jaw-dropping, like faces on Zoom, thinking from legal services organizations, thinking, how in the heck are we going to find time to work on coordinated intake? We actually relayed that concern back to the IALTA funder. They went back to their grantees and said, how much do you need to fund just having these discussions about coordinated intake? I think that helped with investment in the process and their ability to, show up to all these meetings, but also buy-in.
Thanks, Sarah. Okay, and if you could each call out one aspirational or known impact of coordinated intake.
My aspiration is driving down the percentage of brief advice and driving up the percentage of people actually getting in-court representation, settling their legal need, getting really effective assistance from legal aids. I wish we had the opportunity to build those really deliberate, what do we want to see, what metrics do we want to track to see if that happens, but maybe next time.
My aspiration is one phone call. One phone call, right door.
Love it. And I'll just do a known impact. One of the best ones has been fewer silos and more coordination among organizations. I mentioned those director level and intake level meetings we have. We also have regional meetings where we combine the two. And those have really been key, and that's the organizations talking to each other. I had said we already had great relationships between our organizations, which helps, but I think we have learned so much about what the other one does, so much more by having this regular communication, and that's just going to benefit the client in the end.
Okay, biggest surprise so far.
I can start just how long it's taken. You heard 2017, so now we're in 2023. We did have COVID in there in the middle, but I think you just, from an outsider coming in, like, wow, how did it take so long? But the more I've learned about it, it's a process. So just be prepared for that.
Time required.
It's harder than I thought, and I've spent a lot of time thinking about this, but it's also really rewarding.
Okay, and I just, as your final thought, can you bring us back to after all of that time and how hard it is? We've focused a lot on those challenges. Can you kind of bring us back to the why and our purpose?
Sure, it's very easy to get bogged down in the details and get frustrated about the length of time it's taking, about delays, about trying to coordinate herding cats. Since there's a cat on there, I'll reference cats. But if you just step back every once in a while, you have to remind yourself that that's all about improving the client experience and making sure there is no wrong door for a client.
Same.
Yeah, it's that sea change. It's coming to conferences like these and hearing, numbers of people going up that are getting effective legal help. It's really, for me, that really big picture, turning the Titanic around. But yeah, it's one small step at a time.
Okay. Homework assignment is to have conversations with folks around what partners you would need within your jurisdiction to make coordinated intake in your area a success. But with that, I think we probably can stick around for, I think they said we have like 5 more minutes past the official end if folks have other questions. Yeah, Mercy.
I just had a question, and Laura mentioned this concept of internal balance and external balance. So I'm wondering for the other programs, as a part of coordinated intake, the programs also tackle the internal balance, where it's only focused on the external, how you manage those two balance concepts that Laura mentioned.
And the question is, how are you managing internal balance specifically within like the legal aid infrastructure?
I think that's one thing that's great about our partnership with United Way is that I think earlier the mention was about social services interacting with legal services. And because they already have all of that at their fingertips and we're adding in a legal services element, I really hope that we see more efficient connection of, let's say I come in saying I have an eviction case, but United Way can also connect them to rental assistance and possible backup of a homeless shelter. And so we're really going to corral a huge world of resources into one phone number.
Yeah.
Yeah, so all the various organizations that are involved with this still have their own intake, their own website, their own phone number. How do you make sure this isn't just the 81st phone number on the list that people need to call and just one more confusing door to try to go to?
Yeah, great question. The question is, how do you make sure that this new coordinated intake phone number isn't just the 81st phone number that's out there circulating?
I think that's where the communications effort comes in, and that's why the communications piece is so important. And that's what we learned through the focus group. So we have pretty concrete guidance on how to communicate this and where to communicate it so that people understand that it's not the 81st call. The other piece of it is, which was on an earlier slide, in DC, A2J Tech built a provider database. So we had like a number of places where people are getting various lists of where to go to get help, most of which weren't current. And so that will be a part of the communications effort too. So we'll see. But that's the hope.
I think one thing that I think about in Minnesota too is that no matter which door you come into, your experience should be the same. You should, like, even if you call the direct line, you should still get screened for which org is best suited to help you. Same as if you call the statewide number.
And I would just add quickly that on our website, we actually did take off our direct number and just put the coordinated intake. It is a little tricky because you still have to have a direct line for people calling back if they're calling about a case. So we had to put a notice on our website that says if you're calling for legal aid, call this coordinated intake. If you're calling back about a specific case or if you need an administrative, then call this number. So that's how we handled that.
I think this question's for you, Laura. How did you go about coordinating amongst all the legal services organizations in Minnesota to jump on board and use legal server? Was that part of that mandate? Did you have trouble doing that? And was it something where, 90% of folks were already using legal servers, so it's easy for you to speak to them?
Yeah, the question was about how did we get everybody in Minnesota on board with Legal Server?
And that's what I'm going to actually pass back to you, Jay, because that was before my time.
Yeah, so I know there had been past efforts to get folks on the same case management system that were not successful, let's say. And at the time we moved to Legal Server, we had one organization who was already using it, but the others were not. And I think a big piece was that our state funder provided funding for that transition. I think it also coincided with a couple of the larger organizations moving away from, I think, PICA and Practice Manager. So it's kind of my sense is just a lot of different variables came together at the right time to get everybody on board for the first time ever in Minnesota. I don't know, Bridget, is there anything else you would add?
Well, it was required to get state funding.
Oh, and it was required. That was the other
That was the
thing.
short, easy answer.
I don't think I realized that.
How do you measure success? I mean, you guys are on a different level. How do you measure it?
Yeah, how do you measure success?
That's a great question, and we're just starting to look at that. I think Jay had mentioned the dashboards where we're collecting data, so we're working on that. That will measure, how many cases are we taking, what kinds of cases, how many are extended service versus how many are advice. So I would say success would be people not being bounced anymore, but measuring that to see how are we going to make sure that's not happening, I think comes in with the reporting.
Yeah, and I think there's kind of a qualitative and a quantitative. Like, theoretically, we want to see more advice, more representation at the end of this once everything is implemented. And then I think on a qualitative level, we also want it to be a really good client experience. We want to have good customer service and not make it a nightmare to try to find the right organization, even if you do end up getting representation. So for that, we stuck our toes in and we did a quick little survey last spring where like unanimously of the 9 people who did the survey, they said their experience was either good or very good, very like easy, very easy in terms of navigating the system. So we want to do more of that and just make it like a good experience because people deserve that, right? Like just because they're getting free services doesn't, it should be really high quality.
We're good? Okay, we'll let you go.
Thank you so much for joining us.